All right, so another Wednesday night, and good evening to all the wonderful viewers of the adults class. Last week, I'm sure you saw an amazing repeat of what we have been doing on the adults class, and yes, I had a number of calls. I was a little under the weather, still a little under the weather, but I'm going to make sure that I try as much as possible to bring today's show to you. For those of you who've been following the adults class, it's been very very educative, and yes, we can still say that it's the most educative adult show in this country. We can add the whole of Africa to it. My name is Papa Pamina. You can call me Mr. Smooth. And for the past 2-3 weeks, we went round looking at what comprehensive sexual education really was, and what we are looking at, and abstinence based, blah blah blah. Yes, I promised to talk about age appropriate sexual education for young people that parents should know. I have done that recording. It's on my YouTube channel. So wherever you are, whoever you're watching, if you want that video, just get to my YouTube channel, Papa Kwamna Mr. Smooth, and then you'll find that video there. The audio is not too good. It's a little background noise, but the content in there is still very very intact, and it still falls in line with what adult classes in teaching. So parents who want to know exactly at what age and what to tell their children and what to teach their children per their age, from the time they are born all the way till the time they hit adolescence and cross adolescence, I have that video there on my YouTube channel. You just go look for it, age appropriate sex education for parents. Just go look for it on my YouTube channel, Welcome to Mr. Smooth. Today I'm going to start a new series. I'm going to be talking about the ABC of sexually transmitted infections, and I'm sure there are many people who just fix their minds on just one area, thinking that everything sexually transmitted infection has to do with HIV and that stuff. But there are a lot of other forms of sexually transmitted infections that most people are unaware of. So we're going to take the first lesson on the basics, or the ABC of sexually transmitted infections. Today we're going to be starting a very interesting lesson. We are going to be looking at the ABC of sexually transmitted infections. But the first thing is, I'm sure you're going to be asking, what is sexually transmitted infection? Sexually transmitted infection, I would simply say, or I'll simply say that it's an infection that people get when you engage in sex. And I can also say it clearly that it is spread through sexual contacts. And besides colds and flus, sexually transmitted infections are the most common form of infections throughout the world. The World Health Organization is saying that 1 million people get infected with some form of sexually transmitted infection every year, and that is really really alarming. It is interesting to note that some sexually transmitted infections are curable or treatable, and others are not. And if you ask me, how is sexually transmitted infections transmitted or passed on from one person to the other? It is passed on through skin contact. Some types are passed on through skin contact. Some types are passed on through the blood. Some are through vaginal fluids or semen, that's fluid from a man. Some are through even a sore, either in the mouth, in the rectum, or any other part of the body. And then also anyone who has sexual contact with a vagina, with an anus, with kissing, or some are passed through kissing as well, or any person who has some form of sexually transmitted infection. There may be some symptoms that can be passed on to the person who gets contact with the person who's already infected. Now, if you have sexual intercourse, even one time, with a partner who is infected with any of these, for instance, syphilis, gonorrhea, chlamydia, you have the chance of also being infected by this sexually transmitted infection, and over 30% of people get this type of infections all across the world. And I am saying here that the STDs have just one time having an unprotected sex with somebody who has this type of infection exposes you to get this infections. Yes, some people are asking whether there's a difference between STI and STD. The I is simply infection and the D is a disease. So yes, in most times they are used synonymously to mean they are the same. But there are times when there's a difference when you look at the degree at which you get the infection. For instance, if you get the what do you call it? If you're showing symptoms of a sexually transmitted infection, some can be treated simply with antibiotics and you are okay to go. But when you have human papilloma virus, it becomes a disease, and that is a little more difficult to treat than just a common infection. So that will be a little of the difference between a sexually transmitted infection and a sexually transmitted disease. But in most cases, you can use them synonymously. So we should take note of that. So what causes sexually transmitted infections? Yes, they are either caused by a bacteria or by a virus. They are caused by a bacteria or by a virus. If it is caused by a bacteria, it can be treated with antibiotics. But if it is caused by a virus, it cannot be cured, but its symptoms can be treated. So it is something that we should take note of. When it's a virus, it cannot be cured, but the symptoms can be treated. That the signs that it will be showing can be dealt with, but the virus itself usually lives with the person till death. Okay, so what are the risk factors? One of the risk factors what will make you prone to having a sexually transmitted infection is having more than one sexual partner. That is one, having more than one sexual partner, and then a partner who has more than, like you have, I mean, you are seeing the person as the only sexual partner, but the person also has other sexual partners. Then the person will be exposing you to this sexually transmitted infection that we are talking about. And then sex with somebody who already has a sexually transmitted infection would expose you to getting it. And then somebody who has a history of a sexually transmitted infection. Some people, they get the infection and then they just run to the drugstore and then get antibiotics, and then once they start feeling they are okay, then they stop using it, forgetting that the bacteria can hide in the body and also cause other forms of damages or other damage to the body, and you can also continue to pass it on when you have not completely treated it well. So others who are also sharing injections and needles and stuff can also expose yourselves to this sexually transmitted infection. So we should look at that too. So there are types. So what are the most common types of sexually transmitted infections around? Yes, chlamydia is one of them. I'll tell you what it is. Gonorrhea is another. We have the genital herpes is also one of them. Syphilis is one. Trichomoniasis is another one. Hepatitis B, hepatitis C is another type. HIV is another type, and human papillomavirus is another type. Now, most people focus so much on the HIV, thinking that that is the worst of stuff that can ever happen to you. But all these sexually transmitted infections have their own stuff, their own pain, their own difficulties, and their own effects that it comes with that affects you. And most times you don't even have to be worrying about the HIV, because currently there's treatment. If you follow your treatment, you can live. And even for some people, they don't even have counts after they use it for once they stay on their medications they can live their normal lives and even have sex without transmitting it to anyone. So it's important that you you look at it, more than 1 million STIs are acquired every day. From 2006, this is what the World Health Organization came out to say, that there are over 376 million new infections with these STIs every day. People are getting these STIs, and the statistics they had was in showing that 127 million people were infected with chlamydia, 78 million people were infected with gonorrhea, 6.3 million people were infected with syphilis, and trichinomasses people had 156 million people had trach infections. So it is not something that you should joke with. And then also there's herpes infections. Over 300 million women are suffering from human papillomavirus infections, and this become the primary cause of cervical cancers that most women have in our world today. And this is something that we need to look at. An estimated 240 million people are living with chronic hepatitis B globally. And look, hepatitis B is a serious killer. It's killing people all over the world, and there are people who have, over 240 million people have this infection all across the world. So it's very important that you take very serious note at this. And both human papillomavirus and hepatitis B infections are preventable with vaccines. So it's important that if you want to save yourself from this, you go for vaccines against human papillomavirus and hepatitis B. And I tell you, there are so many clinics, there are so many hospitals that can get you treated from, get you vaccines to prevent you from getting these things. Now, STIs can be or can have serious consequences. It can have serious consequences, and everyone is at risk. Everyone is at risk, and STIs like herpes, like syphilis, can increase the risk of HIV acquisition, and threefold. Once you have these herpes and syphilis, the chances of you getting HIV or you living with it and not being able to deal with it is very, very high. So it's important that you take note of it. Approximately, like I said, 1 million pregnant women were estimated to have had syphilis in 2016 alone. And this results in over 350,000 high birth risk, like women giving birth and just at the brink of death because of the syphilis that they have. And then they have children that have they have stillbirth, and it's amazing. And human papillomavirus causes 570,000 cases of cervical cancers all over the world, and over 300,000 cervical cancer deaths each year. So these things we are talking about needs to be looked at. People are just looking at just a little bit of the whole thing. Sex is good, but if not done well, can cause death, can cause serious consequences for people who are engaging in it. And we are seeing here that STDs such as gonorrhea and chlamydia are the major causes of pelvic inflammatory diseases and infertility in women. And the unfortunate thing is, women get gonorrhea, and most women, if they don't have a man who sleeps with them and shows the sign and gets treatment and probably informs them, some live with them, and if it's with you or on you for a period, it becomes a problem. You have a problem with fertility and all that. And then more than 30 different bacteria and viruses and parasites are known to be transmitted through sexual contact. So it is not just the HIVs and the gonorrheas and the syphilis and all this stuff. There are more than 30 different kinds of bacteria and viruses that can be transmitted through sexual contact. So it should be very, very important for people to look at it. 8 of these are linked to these sexually transmitted infections. Some of them you may not even take note of. And of these 8 infections, 4 are currently curable, like the syphilis, the gonorrhea, the chlamydia, and the trichomoniasis. These are treatable, but the other 4, they are untreatable. The other 4, like the hepatitis B, another problem. Herpes simplex is another problem, is a virus. HIV is also a virus, and a human papillomavirus is also a virus, and these are not easily dealt with. They're not easily dealt with. So it's very, very important that you stick to one partner, and then when you're not married, like I keep saying, it is best to abstain. Just get yourself off the sex thing. There's more time for you to experiment when you get married. So symptoms or diseases due to this incurable viral infections can be reduced or modified through some of these methods. So first of all, a person can have sexually transmitted infection without having obvious symptoms of the disease. So you can be having that infection, a sexually transmitted infection, without showing any sign. That makes it dangerous. Very, very dangerous, because you have it and you don't even know you have it because you're not showing any sign. Nothing is making you feel that you have that infection, but you have that infection. And as you continue to have sex with other women, sex with other men, you continue to spread. And then some women, when they are fortunate enough, will start showing the signs. Some men, when they are fortunate enough, after you have passed it on to them, you start showing the sign, and you may not even know, or you may not even be aware that you have that infection. So some common symptoms of the STI include vaginal discharges. These are signs that you see when you have some discharges from the urethra. When you have burning sensation as a man, you have burning sensation inside the urethra. And then when you start having some genital ulcer, and so you start having some abdominal pain. These STDs, you need to do general checks to make sure that you don't have them. STIs are spread predominantly by sexual contact, including vaginal, anal, and even oral. Through oral sex, or it can, for the body fluids, you can get it. So some STIs can also be spread through non-sexual means, such as via the blood, or even from products that something that you have touched or something that you have used. So we need to look at it. There are many types, including syphilis, hepatitis B, HIV, chlamydia, gonorrhea, herpes, human papillomavirus. They can also be transmitted from mother to child during pregnancy and during childbirth. So we need to be careful with these STIs. And I just want everyone to just have an understanding of what it is, how it's transmitted. You can also get STIs. So the one question I'm asking is, can you get STIs from a toilet seat? Okay, so yes, many people consider toilet seats to be a public enemy number 1, but from a plain background, STDs like chlamydia and gonorrhea, you can't get them from the toilet seat. But before you panic, the toilet seat is not a common vehicle for transmitting infections to humans. So let's relax about that. You can't just get this sort of sexually transmitted infections or these infections I'm talking about just by using toilet seats. So you shouldn't be alarmed about it. Yes, friction can break a condom. So you should also know that condoms cannot be 100%. Not putting on the condom well can also cause a condom to break. So you can still use a condom, still break the condom, and still get a sexually transmitted infection. And then using the oil-based lube, like coconut oil and all those things, can also cause the condoms to break, especially when the condom is made from latex. It can also break. So, and the vagina can also break condoms. I know women who have trained themselves. Like I keep saying, yes, you can train the vagina to remove a condom. You can train the vagina to break a condom. You can train the vagina to stop penetration. And women who have given birth and want to train their vagina, we can still talk. My number is on the screen. We can still talk and you can learn how to do that. I'm saying that, yes, women can remove the condom, women can break the condom, and women can stop you from using the condom, especially when they don't want you to use it. So yes, condoms can break, and when they break, you can also get yourself transmitting these ill diseases, or passing it on from yourself to your partner, or from your partner to yourself. So we are saying that, how can STIs affect pregnancy? The fact that you are pregnant, yes, can cause some harm to your baby. So if you don't treat it well, if you don't get help if you don't get medical help and take some medications that will prevent you from passing it onto your child, you can pass it onto your child. You can also pass it onto your partner. You can be pregnant, you don't have it, but you have sex with your partner who eventually gets infected, and then also it can infect you and even infect the baby as well. Gonorrhea, chlamydia, both can cause health problems in infants. Gonorrhea and chlamydia can cause health problems in infants. Gonorrhea can even affect the baby's eyes, and you give birth to the baby and you see some funny yellowish stuff around the eye, which is form of infection coming from the mother who has gonorrhea, who is giving birth to a baby. It affects the eye and all that. So we need to take care of that. Syphilis can also cause miscarriages or stillbirth. So if you have syphilis and you're pregnant, you can also get a miscarriage and have that sort of problem. HIV infections can also be passed on from baby to from mother to the baby. Inside the mother's womb. But recently, there are medications that the mother can use to prevent herself from transmitting it into to the unborn child. So you really need to take medical care and stop yourself from passing it on to your child. So it is best to treat your STIs early to decrease the chances of you passing it on to your babies. It's very, very important that you see it early, you go for the test early, so that you don't have to pass it on. So here we're asking, so what is the most common STI in the world? Good. From research, we're saying that more than 600 million cases worldwide of human papillomavirus. So it means that there are more infections of human papillomavirus all over the world. All over the world. And this is according to the World Health Organization. The World Health Organization. So what is the most common type of STI in men? The most common STI in men is chlamydia, gonorrhea, trichomoniasis, genital herpes, and these are the most common ones that you can find. And then yes, HIV is also a part, of those sexually transmitted infections that you can find all across the world. Okay, let's look at this too. Is HIV the worst STD? Human papillomavirus causes genital warts, abnormal. Yeah. What I want us to understand here is most people will think that HIV is the most dangerous or is the worst form of sexually transmitted infection. But I can also tell you for a fact that research is showing that human papillomavirus is rather the most dangerous form of sexually transmitted infection ever found in this world. So it is linked to all cancers of the penis, all cancers of the vulva, all cancers of the anus, and what most people are calling cocoa is human papillomavirus. And I'm going to show you some pictures of them as we go on. So can kissing cause you to get sexually transmitted infection? Okay, so we're saying only certain sexually transmitted infections or diseases can be transmitted through kissing. Not every one of them can be passed. The two common ones that can be passed through kissing is herpes and yes, herpes is one of them. You can be transmitted through kissing because when you have direct contact with the saliva, you can pass it to your partner. And then also, how can you reduce the risk of getting STIs? The most important thing is, one, you should know your sexual partner, and you should know you have a limit of number of sexual partners. You shouldn't have too many of them. You should know your sexual partner's sexual history, and then also you should insist on the use of condoms for protection. And then also there is something we call the dental dam. The dental dam is a film that we use in covering the vagina or around the penis so you can have oral sex without getting direct contact with the person who has the infection. You should find dental dams to use if you want to engage in oral sex. And then also you should try as much as possible to avoid this lesbian gay stuff, because yes, that set of people have a high prevalence of getting these infections. So it's very, very important that you look at that, because once you get into that world, you put yourself at high risk. And then body fluids in general can also cause you, so you need to really watch body fluids in general if you don't want to. And then also avoid risky sexual practices like tearing each other, biting the skin, exposing yourself to cuts, and some people are really, really open to all sorts of crazy sexual acts. All those crazy sexual acts can lead you into getting hurt and getting these infections spreading all over. So it's important to minimize as much as possible yourself from getting HIV, from getting hepatitis B, hepatitis C, as much as protect yourself from getting human papillomavirus. Now, I'm just going to show you some pictures of some of this sexually transmitted infections. It is very, very disturbing, some of these pictures, and if you see them, it should tell you that yes, some of these pictures are very, very disturbing. And this is one type of infection that you can get from the vagina. It's an inflammation of the vagina, of the vulva and the vagina, and that is how it looks like. So you can see the You can see the, what do you call it, the vulva opening, and then you can see the swelling in there, and this can what do you call it, it's not very, very pleasant. It's also some form of infection that women get. This is another type, trichomoniasis, that you can see that the skin wears off around the thigh. The skin wears off, and you see, I mean, some watery liquid coming out of the vagina, and it gets wet, and they think it's just the skin that is spilling off, but it is the infection that is flowing out through that. Yes, so this one is also caused by bacteria. This is a typical example of trichomoniasis, and this is also a sexually transmitted infection that can also cause vulva vaginitis. And you see that you have this watery yellowish discharge, sometimes greenish bubblish bubble coming out of the vagina, and all these things are infections. It has the very foul fishy smell. It smells like rotten fish, and normally you have this watery stuff like that coming out from the vagina, and then it wets your panties, wets your dress, and stuff like that. When you have such infections, you just link up with me. Let's get you some help on these things. And usually it's very, very painful when you are urinating. It's very, very painful, and you see some redness and some swelling inside the vagina, like you saw in the previous picture. You see all the redness and all the bumps in there, and this is a typical example of a sexually transmitted infection called trichomoniasis. Yeah. Okay, so this is another example of the fluid that comes from the cervix, and this is also trich, and you can see you have this very whitish fluid that is foaming, and then you can see all the redness inside the vagina, all the red small bumps in a picture down there. You can see it. This is a sign that this is a, sexually transmitted infection, and you need treatment. And then also you can have this type also that affects the body. So most people think that it's just the HIV that hits on your body, but look at this what do you call it, type of virus, bacteria infection too, that affects the entire body. It can mess the entire body up, decolor the whole body. So observe it. Put your eye on it, and then make sure that you don't get such stuff. And then this is another very disturbing infection called chancroid. Chancroid is a very, very disturbing, and normally it causes ulcers on the genital. And when you see some of the pictures, it's very, very disturbing. So you see sores like these. That's how they start. They start like sores like this. When you break them, then the water spreads to the next place, and then you have another sore there, and that is how it comes. You see them that way. It's very, very disturbing, and it can chop off part of your male organ, chop off part of the female organ. They are called, and like I said, this is called chancroid, and these are very, very gory stuff, and these are also sexually transmitted infections. Yes, sexually transmitted infections. They are not just stuff that I'm showing you. And then you can see the sore on the male organ. Yes, these are all sores or ulcers. They are called chancroid, and it's a sexually transmitted infection, and you can get it when you have sex with somebody who has this type of infection. There are some people that they have it, but it will not show immediately, and then you go and put your stuff in there, you go and put your nice tool inside here, and then you're going to get the stuff. So you need to be very, very careful with it. And then you can see this other one too. You have this sort of pimple like stuff. They are a little painful, and then you break them, and as you break them, they spread, and you get this type of infections also through unprotected sex, either through oral sex or through anal sex or through vaginal penetration. You can get this type of infections as well. And then also you can have this other problem too. And yes, this is also a sexually transmitted infection that is also caused by bacteria. And chronic inflammation will be caused around the genitals, and you have this whitish fluid coming out of the penis, and then you also have this swelling and funny discharge inside the vagina as well. So these are also sexually transmitted infections. They may not be that common, but they are there, and it's possible that you don't know where you're going to put your stuff, and you may be getting stuff like that. So you got to be extremely careful engaging in sex when you are not married. This is a typical example of chlamydia. Normal, abnormal, what do you call it? You have the vagina, you have this yellowish discharge, you have a strong smell, you have some spottings inside or in between your periods, and you have some rectum breaking up and all that, and then you have this water-like stuff coming out of the penis, especially if it is not fluid coming from the seminal fluids. So you need to be very, very careful when you see these signs. You quickly need to check yourself, seek for medical help. And yes, these ones we can always get treatments for it, and it even affects children. When you give birth, you can pass it on to your child. So let me just show you one last one, and then we can run. And yes, we'll allow a few phone calls and read a couple of text messages and become interactive with you. And yes, can have some 6 minutes to get interactive. So Mustafa, if we can put the phone line out there, let's pick a couple of calls whilst we read a couple of messages. Yes, Mustafa, put the phone line out there. If don't call me on this line, because I'm going to be reading messages from here. Okay, all right. So my producer is saying that we can pick calls. So what we'll do is next week when we come, we would pick your calls because we don't have too much time. And yes, there are a number of messages here. Hello, I am Yakubu. I'm watching live inside Kumasi. You said you're doing a great job. Keep it up. Thank you very much, Yakubu in Kumasi. Hi, teacher. This is a very long one. Hi, teacher. I am called Isaac. Good evening. Just that I am calmly enjoying your program tonight. I was really enjoying Sister Seto's teaching more, but this one is a little too long. Make it a little short. I will look at it. Okay, somebody just said hi, boss. Okay, many messages. Okay, yeah, this is from Yakubu again from Kumasi. Okay, I went to the hospital to check up, and after I had an intimacy with a partner, but for my results of test, none of the diseases was found in my blood test. Okay, all right. So there's nothing wrong with you. That's we thank God thank God. Are all these rashes on the penis STIs? Yes, all the rashes you saw on the penis are STIs. Okay, my name is Patience. Oh, nice show. Thank you very much. Please, does hepatitis B have cure? Yes, you can vaccinate yourself against it, but for now, I don't know if there's any cure for for it. I don't know. Okay, good evening, Mr. Smooth. I'm glad you are dealing with this today. My girlfriend told me she has hepatitis B and was born with it. Wow. Can that be transmitted to another person? Oh, you call me later. Let's have a chat on this one. All right, so it's beautiful coming your way. For all my friends who are in WA and its environs, on Saturday I'll be at Mama's Kitchen. We're having a little expose there, a little seminar there. So if you are around WA and its environs, Mama's Kitchen at WA on Saturday evening, I'll be there. And for those who are at what do you call it, Damango Catholic Church, yes, I'll be there on Sunday as well, and then we'll run all the way to Tamale and then back to Accra. And yes, so whatever questions you have, you can call me later. We can have a chat. And those of you who are having issues with your premature ejaculations and all this stuff, we're still trying and helping people all across this country and across Africa as well. So yes, I'm sure you have learned something really, really amazing today. And for those who were unable to get your messages through, keep it coming. I'll read them, I would answer them, I'll get back to you. And next week when we come out, try and as much as possible to create room so we can become interactive, and we'll continue from where I left off today, next week, God willing. So stick and stay with us. This is adults class, and I'm sure you have learned something really amazing today. I would be back next week with another wonderful session. Be good, and thank you very much for watching. And I would want to thank the entire JN and ATV crew, especially Mustafa for helping, and for Mr. Mishman Kilsing, and everyone who has made this show possible. I want to say thank you very much, and I love you, and keep encouraging us. We are still looking for sponsors to carry this show. So let's talk and let's get something going. Thank you very much for watching. It's Adults Class, and actually the best and the most educative adult show in the whole of this country. We'll be back next week. Thank you.
Yet, Panama.